This is Going Under Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh, and we are brought to you by
the Butterfly Network. All right, I'm going to let you in on something that's completely changed the way I practice. I've been using Butterfly probes for years. It's a portable ultrasound that plugs right into my phone, smartphone, or tablet, so I can start scanning at bedside in seconds. If you use the older versions, or even if you're new to handheld ultrasound, let me tell you why the new IQ3 is a game-changing, really impressive tool. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. There's biplane imaging, which lets me see short and long axis simultaneously, huge for procedural guidance and honestly a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart systems that I've used, and that's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
And welcome to the show. It's been a little bit since you and I have just done a podcast, just the two of us.
Yeah.
And we've got a few new followers here since our episode on the pit.
Yes.
So for those of you who are new to the podcast and new to the channel here, Brian, just kind of give a little explanation as to what we talk about and, you know, your background and just so people can get a reintroduction.
Yeah, so I'm an anesthesiologist. I won't go through my whole background, but did some private practice, did some academics, have a PhD in neuropharmacology. So, but also own and operate my own anesthesia business and then do a lot of administrative work as well. So what we do on the show, we just try to delve into any topics in medicine, even in sort of culture, anesthesia specifically. We do a lot of that, and then just try to bring knowledge to the followers.
And sometimes, as in season 2, we dive into some of your personal likes and dislikes, and try to bring people that have influenced you along the way onto the podcast as well. And I'm just here representing the general public, so that's me,
the non-physician side. Yes.
One day I'll get my degree. One day. In MD degree.
Yes.
All right. Today we're going to dive into a few different topics.
Yeah, a couple topics.
The ACA is one of them, and you said the anniversary is coming up on the Affordable Care Act.
15 years, in fact.
So let's go into what the ACA is, who it was meant for, and what is it accomplishing today?
So the ACA is also known as Obamacare. So whatever you think of Obama, whatever you think of medicine in general, the ACA was a huge piece of legislation. I think it was like 3,500 pages. And the Speaker of the House at the time famously said, "We have to pass it to know what's in it," which is always good to hear from your representatives. So the ACA did a whole lot of things. The proposed goal was to get more people health insurance and to kind of change the way medicine works in the United States. What I would say 15 years later, looking back on it, is essentially it did what a lot of the detractors said it would do, which is it drove up the cost of healthcare. It moved the pendulum from sort of smaller practices, physician-run and owned things, to big conglomerate corporations, hospitals, insurance companies running things. And it basically, again, in my opinion, was a money grab and a control grab from the federal government to get its hands even deeper into the healthcare realm. Healthcare is a huge portion of our GDP. There's a lot of money in healthcare. So that, my opinion, there basically was a big money grab. So the reason we bring it up, there's a couple of things. One, it's like the 15-year anniversary, right? So let's take a look back. And Zane, one of our friends of the show, took a look back at it and did a really good reel on it, where he showed the number of people covered and basically a lot of statistics on how healthcare is no better. But the one thing that did improve was United Healthcare and Cigna's profitability. So it skyrocketed in 2010. The reason for that is that there were two things in the ACA, and then we'll get to the physician-owned hospital part. But there were two aspects of the ACA that were meant specifically to benefit the insurance companies. Actually, three if you count sort of the no pre-existing conditions. But so number one, there was a mandate that everyone had to have insurance, health insurance. Period. You have to have health insurance. So
if you're a citizen of the United States,
right, you just created millions, maybe hundreds of millions of more customers for these insurance companies. Number two, it protected the insurance companies even further from litigation. Okay. Number three, I guess there's four then. Number three, all of the government plans through the ACA, so the Obamacare plans, are administered through the commercial insurance companies, United Healthcare, Cigna, Aetna, Blue Cross Blue Shield, right? So all these companies just also took over basically all of Medicare and Medicaid and Obamacare, okay? And then finally, you can't be denied for pre-existing conditions. So it just took a bunch of people who wouldn't have had health care or health insurance, and put them on health insurance plans. So it was a big benefit to the insurance companies. Has healthcare gotten any less expensive?
No,
correct.
And it's gotten more expensive.
More expensive, correct. Has it gotten better? I don't think so.
I mean, look at what's happened since Obamacare.
Yeah.
In the world of medicine.
Right. And the health insurance companies continue to screw over the American people. So that was huge. And then, of course, the Obama administration did what all money grab administrations do, and the Johnson administration did the same thing when they instituted Social Security. I think it was Social Security. They basically said, they told the American public, it's not a tax, it's a mandate, whatever. And then when they went to the courts, because it got challenged to the Supreme Court, they said, oh, no, it's a tax. We can tax anybody we want. FDR did the same thing with, I believe it was Social Security. And anyway, this is what happens when the government oversteps. They just go to the Supreme Court and call whatever they did a tax. So that's essentially what the Obama administration did with the ACA.
Who got, for lack of a better word, screwed over by this?
The American people. All of us, right? Because we're having to dump more money in because it was insanely expensive. There were a ton of taxes affiliated with that. And the money now doesn't go, there's more layers now of where that money goes. It doesn't go, patient, insurance company, physician, or even patient physician. Now it's patient, government, insurance company, physician. So you're adding more layers, you're adding more cost, you're adding more bloat. One terrible, terrible thing that the ACA did, which I think is what we want to talk about today, is it now, as of 2010, prevents any physician from building a hospital. So you can only buy in to a hospital that's already purchased or already created. You can't create a new hospital if physician ownership is the largest percentage of ownership. Well, that was a nod to the American Hospital Association, who didn't like that physicians were building their own hospitals and taking away all the good cases from their hospitals.
So what if you're grandfathered in? Like, I mean, did they?
Oh yeah, there were
even in our area.
Yep. Well, I mean, so the hospital I work at has other ownership besides the physicians. But for instance, the hospital I work at in Indianapolis, they were a surgery center at the time. And as soon as that passed, in the interim between when it passed and when it went into effect, they built a 42-bed hospital.
Wow.
Just to get in under the radar. Right. Or under the time frame.
So I'm assuming there's some grandfathered in, but
there are.
I mean, this really puts. I mean, it puts a hamstring on what you are trying to do as a medical community.
Of course, yeah, and if you look at the ratings of physician-owned hospitals, patient ratings, the ratings from the government bodies, you look at the cost effectiveness of physician-owned hospitals, they're way better than non-physician-owned hospitals. So, I mean, really, this was just a special interest. The American Hospital Association went to the Obama administration and said, "Hey, put this in there too. While you're changing healthcare fundamentally, we don't want doctors to be able to own their own hospitals anymore." I mean, it's crazy.
Why? I'm going to ask this question, and it's going to ruffle a lot of feathers. But whatever. We're chatting here, and I'm just kind of thinking to myself as we're talking about this. Why not put hospitals in the hands of the physicians who know medicine? Why put hospitals in the hands of the American government or government in general?
Or to a bunch of administrators, right? So you look at, and I think I've shown this graph before, maybe on my social media. You look at even before the ACA, but especially after the ACA, the number of administrators, people who don't do any clinical work, just straight administration, even not clinicians, has skyrocketed like 50 times, right? The number of physicians, clinicians, people actually taking care of patients has remained almost flat. So all that money in healthcare, that everything is getting more expensive, it's not going to the clinicians. All that money is going to the administrators who are making dumb rules and then basically enforcing dumb rules. So you can find these graphs. We can try to find one and post on a link. But I mean, there's just so much bloat, not just in the government, but in any hospital. Any hospital, look around. If you go into any hospital, how many of the people walking around are actually doing any clinical work, are taking care of patients? It's very few. There's a lot of people running around with clipboards saying, do this, don't do this, making policy, all kinds of stuff like that.
I remember a day where the CEOs of hospitals were physicians.
Yep, not anymore. Very rarely anymore.
So, this may be a little off topic, but what are the percentages, and you may know this off the top of your head, and you may not, what are the percentages of doctors who are actually going to get MBAs after? Because I know that used to be a norm, right? I mean, you would
sometimes, some would.
You would go, if you wanted to further the education and further kind of the path like that, but people getting an MBA to do both, right? Yeah. Where you're trained in that area, I feel like it's few and far between now.
Yeah, not enough. Not enough. There aren't enough.
Is that an incentive or like what is the?
Yes and no. I mean, an MBA is expensive, especially like an executive physician MBA is an expensive process to go through. And then we're not really, as physicians, we're not really looked upon as somebody that they want in hospital administration. I mean, there are not that many physicians in hospital administration. The CMOs are typically physicians, but aside from that, a CMO has some power, but not the power that a CFO or a CEO or a COO has. So, I mean, there are not enough physicians who are helping run the healthcare system.
So it all boils down to money.
It does, always.
Where do we go from here? What is the solution to all of this? What is the solution to putting the power of medicine back into physicians' hands?
Well, I mean, you could easily repeal the portion of the ACA that said that physicians can't build and own hospitals. I mean, that's an easy portion to just get rid of, right? I think it's that physicians need to take a bigger role in hospitals. Private practice, though, is hard now, right? I mean, there's just too many pressures coming from here and there, and you got private equity now coming in, buying private practice groups, and hospitals are owned by private equity. I mean, it takes so much money now to maintain a medical practice that it's hard for private practice to survive.
Concierge medicine?
Yeah. I mean, direct to consumer stuff. So not just concierge medicine, but like we've talked about before, there are certain groups in our town that go to the RV industry and they say, hey, listen, we'll be your group for these 5 different things. We'll go direct. We'll negotiate a price direct. We cut the insurance company completely out. We cut the hospital completely out unless you have to have something catastrophic done. Everything is direct. And that gets all of these other people who really don't contribute much, if anything, to the care of the patient out of it, gets their hands out of the cookie jar so that the money, there's much less cost when there's less people involved.
So what do you say the solution may be? To repeal that first?
Oh, well, yeah, I think that's number one. You can very easily repeal the portion of Obamacare that says the physicians can't own hospitals. We're no fan of insurance companies here, so I think, if we can either either somehow limit the power, either through legislation or some way limit the power of the insurance companies. That's a big step, or eliminating them completely. I mean, those are the two things really that I think we can do. I think private equity maybe has a place as a financial backing in healthcare, but private equity driving healthcare like it's doing now is also a big problem. So, and there's a bunch of legislation out, both at the state level and at the federal level, to limit or eliminate private equity in healthcare. And so I think that's probably a good step as well. Aside from that, I don't know what else we can do. I mean, there's no way they're going to repeal and eliminate Obamacare at this point. There's just no way to get rid of it. It's too entangled in everything. But I think you can take an approach where you can get rid of certain pieces of it, particularly the very expensive pieces or the pieces that were done just to appease a certain section of society that allegedly paid to have their pet projects put in there.
We've talked about in the past how, you're seeing less and less anesthesiologists, more CRNAs, more AAs, more of those, practices where the school is not as intensive and
it's different. I mean, it's different. It's different as a physician versus a non-physician anesthesia provider. I mean, I think we've talked about this before. When it comes to doing the anesthesia job, I feel like there's a lot of very quality providers. Whether you're saying doc, CRNA, AA. I think what we bring as anesthesiologists is the overall medical knowledge, right? 4 years of medical school plus a year basically doing internal medicine. There's a lot of things that I see and know preoperatively, postoperatively, and when I round on the floors, which is something I do as an anesthesiologist, that a CRNA and definitely an AA are not trained as well to do. So
we're seeing less of you. We're seeing less of you.
Well, we're seeing the same number because CMS only so Center for Medicare and Medicaid Services funds residencies. And so as they fund residencies, there's only a certain number of anesthesia spots. Those spots change very little, but there's a lot of people retiring from anesthesia. So every anesthesiologist residency spot is filled. I think, at least it has been for the past few years. The problem is there's more anesthesiologists retiring than we're training. Yeah.
And is that true for other clinical medicine?
Most areas of medicine. As the baby boomers get older and retire, not only are they retiring, but there's also more of them needing care. So we've got more demand and less supply. I mean, it's bad in every area. It's bad in anesthesia for sure. It's bad in radiology. Primary care has had problems for 50 years trying to fill. They don't even fill enough spots, but there's not enough primary care physicians either.
Well, if you get a chance, and I'm talking to the general public here, our listeners, if you get a chance, listen to our podcast from season 2, I believe, with the head of CCI.
Yes, yeah.
Because and we'll link it below, but in that podcast, we specifically talk about filling roles and talk about the number, not only of anesthesiologists, but, folks going into clinical medicine as a whole. And, what does the future look like? What does the future look like if insurance companies are going to be like how they are or how they've been, with the Affordable Care Act being how it is, and with, the power being taken away from physicians more and more to put in the hands of the government or
non-government agencies, insurance companies, hospitals. Yeah.
What does the future of medicine hold? We've talked about this plenty of time, but what does it hold?
Well,
and maybe that's one of the big topics we're not discussing in 2025. We're discussing AI, we're discussing all these things, but maybe we're not discussing this enough.
Yeah. Well, and I think this comes to another issue that we wanted to talk about on this podcast in particular is, there was some either senator or congressman who put out a tweet about, or whatever you call it nowadays, about how there's an X, how there's not how there's a huge percentage of physicians not doing clinical medicine. I think he said something crazy like 40%, which I can't imagine is true. But I think there are more and more physicians in particular who are getting out of clinical medicine because of all these pressures, right? Work harder, make less money when it comes to, inflation adjusted dollars, and have almost no control, right? Everybody else, all the other special interests control everything in medicine, the healthcare company, the health insurance companies, the hospitals, the private equity firms, right? So there's more and more physicians saying, forget it. Why would I want to go and kill myself for less money, right? Or, like work super hard for less money. I'll go take an administrative job, or I'll go work at like Devinder. I mean, he still does clinical medicine, but like Devinder, he's a CMO of a medical device company. There's a lot of other things that you can do with a medical degree that don't involve actually taking care of patients. And basically what you're going to do is you're going to drive away the majority of entrepreneurial, smart, highly motivated physicians, because they're going to look at it and say, I can make X dollars doing a bunch of call and clinical medicine, or I can make X times $2 doing none of that stuff and not have to be in a hospital at night and not have to be told all the time how expensive you are and what you can and can't do. So I think while the tweet was inaccurate in its numbers, like 40% of physicians aren't doing medicine, I think that's craziness. I think there are more and more, and there will continue to be a huge push for clinicians to get, physicians in particular, to get out of clinical medicine and to do something else that isn't as, honestly, that isn't as hard and isn't as, at the end of the day, demeaning to somebody. I mean, we as physicians have more education and more knowledge about the patients and about the disease processes and about what should be done than, honestly, the people who are telling us what we can and can't do, the insurance companies who are telling us what we can and can't do, the hospital administrators who are telling us what we can and can't do, the private equity companies who are telling us what we can and can't do.
It sounds a lot like the corporate ladder. Yeah. I mean, people leave corporate jobs for the same reason, right? Mm-hmm. I mean, like, you see it every day.
Yep.
It is the less pay, do more. That's big company, putting the pressure, and almost to the point of, let's get these old dogs who are making the money out of the picture so we can bring in the newer,
right.
They want it, that, maybe they're not as trained, maybe they're not as seasoned,
right? But they're going to do new ideas, new ways to do things. So, and here's the big thing that I've said over and over again is that the baby boomer generation took over our government, gutted us. Those of us who aren't baby boomers, they gutted us financially, took it all for themselves, and they are not willing to give it up. It's the same thing in the health insurance industry. It's the same thing in hospitals. I mean, my parents, my mom is a baby boomer. My in-laws are baby boomers. I love them. But that generation needs to go away. We need Gen X and millennials and even Gen Z to start coming up through and changing things, right? And I'm not advocating for things like taking away Social Security, but look at how much money Social Security is costing. And it's not their money, it's our money that we're putting in, right? Mm-hmm. All these social programs, all these governmental programs, and we're getting very political here, but I'm not right or left, right, on this issue. I'm just saying this is the way it is. I'm saying financially we can't continue to take all the money from the current working generations and give it to a huge group of people who thinks they just deserve to have all this money, or all these programs and all this kind of stuff. So that's a whole big another issue. But yeah, I mean, the baby boomers just need to get out of the way. We need to fundamentally change the way we think about corporate, everything, government, all that kind of stuff. We need younger, just get the baby
fresh
boomers
ideas
out of the way. Yeah, fresh ideas. But also, we've got a huge group of people taking from the system and not contributing.
Right.
And that's true in medicine too. You've got a bunch of, no offense to the older docs, but you got a bunch of old docs who are just hanging on, making a bunch of money, not really doing much.
Right.
But it's that whole mentality of the baby boomers. And I would advocate for everybody to read the book, The Fourth Turning. I don't know. We've talked about this before. It's I think it's Bill Strauss and Neil Howe, I think, are the two guys who wrote it. They wrote a whole set of books. They wrote the fourth turning. They're the ones who coined the term millennials. They wrote a book about that. They wrote a book about all the generational stuff. I would advocate everybody reading about how all the different generations come around, and their premises, I think, are pretty good, but it doesn't necessarily mean they're perfect. But I would advocate reading those books to really understand what's happening from a generational point of view. Everybody who knows me knows I'm a big, like, looking at the different generations and how that's affecting everything that's going on.
Well, I mean, to put it kindly here, I mean, I think it's pretty obvious that Gen X and Gen Z
and the
millennials are very much an entrepreneurial spirit type of generations.
Yeah.
I would say millennials maybe more so than Gen Xers.
Yeah, probably.
But, you know, what's happening is, and I've noticed this in medicine from an outside perspective, just being around you and being around these doctors, it's a young man's game.
Yep.
That have fresh ideas, that get out on social media, that think kind of differently, that are using some of these techniques a little bit differently than kind of the baby boomer generation, right? It's a different way of doing the job.
Well, and it's not just that. It's also that our generations, X, Millennial, Z, don't necessarily see medicine as their entire identity, right? If you look at these older, particularly surgeons, these guys are going to die in the hospital, and some have, right? Whereas kind of Gen X, Millennials, and Gen Z look at medicine as it's my job, right?
It's sectioned off.
Yeah, and I care about my job. I'm going to do the job to the best of my ability. It is my career. It is my it is a big part of who I am, but it's not all of who I am.
Correct.
And I think you see that too, and maybe you notice this as a patient. I think if you look at Gen X, Millennials, and Gen Z, a lot of them say, like, hey, call me Brian or Dr. Brian at the most, right? Whereas the older guys are like, I am Dr. Schmutzler, and you will call me Dr. Schmutzler, and I earn this. And I think I'm like, whatever, you call me whatever you want. Like, I ask the nurses to make sure they call me Dr. Brian when I walk in the room so that people don't think I'm like cleaning the floors or emptying the trash. But aside from that, I don't care if my patients call me by my first name. It's just different. It's not being a doctor is not the core of who I am. It's my job and I care about it, but the core of who I am has nothing to do with being a physician.
My wife and I were talking about this the other day, and it was the same conversation. You know, when we were kids, more so me than my wife, if we didn't call that person Dr. or Mr. and Mrs. So-and-so, I would hear about it.
Oh, yeah. Yeah.
I would hear about it. I still hear about it.
Yeah.
But, I look at my son, who's in 5th grade, and he's like, oh, teacher A or teacher whatever, or Mrs. A, or, it's not, and they call our friends first names or, it's just, it's the different generations and what they're comfortable with.
And I always, and I'm sure you do too, I tell my kids, like, you always start by calling them Mr. or Mrs. or Doctor or whatever. But I would say 90% of people in our generation and younger just say, yo, just call me Brian. Just call me Vahid.
Correct.
Just call me Steve.
They will tell you.
Yeah, exactly.
If you ask them, they will tell you.
Yeah.
Always start with because that's the generation I came from.
Right.
But get to know that person.
Right. And they almost always say, They
will tell you. They will tell you. This has been a good conversation.
It has. And I don't want to. So I am very, very big on the generational stuff, and I am very, very harsh on the baby boomers. But I think I want to be harsh on the baby boomers, not because I don't appreciate what they have done, but it's just time for them to get out of the way. They are almost single-handedly bankrupting and ruining our country, right? And I'm not saying each individual one, right? I'm not saying your parents and my parents and each individual one, but them as a cohort. I mean, there has to be there has to either be a fundamental change in mentality, or they honestly have to, as nature takes its course, go away. And I think, if you read The Fourth Turning, as that happens, we will come out of the crisis that we're in. I mean, we're in the crisis, according to that book, we're in the crisis period for the next about 5 or 6 years. about 5 or 6 years from now, the majority of the baby boomers will have passed on. And then we will be at a point where, Gen X, millennials, and even Gen Z will now be running things probably more efficiently.
Man, Brian, Mercury's been in retrograde for a long time.
I know. The age of Aquarius or something, right? That was, yeah.
All right. Well, this has been a spirited conversation once again.
It
And
has.
I'm sure it'd be nice to get one of those
baby boomers on the show. Can they work a microphone? I'm not sure they can work a microphone.
Oh boy.
Yeah, you talk into the microphone. No, I'm just kidding. I'm kidding.
We're gonna end on that note.
Yeah.
For Dr. Brian Schmutzler, I'm Vahid Sadrzadeh. This has been Going Under, Anesthesia Answered with Dr. Brian Schmutzler. And of course, we are brought to you by the Butterfly Network, and we'll see you in the next episode.